Thanks to tremendous technological advancements and new innovative surgical procedures, the dream of clear vision without corrective lenses can now become a reality for almost everyone who wants to live a glasses-free lifestyle. A cataract is a clouding of the eye's natural lens inside the eye, which interferes with light reaching the retina. Left untreated, it can eventually cause blindness.
I've been noticing a small change in the last few years by going to my optometrist, getting new glasses, and each and every one of them I wasn't too happy with. The vision was not up to par. And the last sort of dangerous thing that happened was I almost got into an automobile accident because I couldn't distinguish stoplights, the red or the green, from a distance driving down a main highway, which frightened me a lot.
The good news is, cataract surgery is the most common and one of the most successful surgical procedures performed today. Vision for most people remains relatively stable until they get into their 40s, whether they're nearsighted or farsighted or normal-sighted. Around that time, the eye's natural lens begins to gradually thicken and harden, making it difficult for the muscles inside the eye to focus the lens. This is known as loss of accommodation, or presbyopia, and its earliest symptom is difficulty seeing things up close without the use of reading glasses or cheaters, as some people call them.
My vision started to be noticeably poor up close, from close range, around 45 years old. And at which time I did get my first set of glasses, and I continuously went to the doctor every couple of years, and they always had to be upgraded. I went through the transition lenses. I even tried contacts, which were just a major problem. So I was at a loss, to continue. I started to go and get another set of glasses when I was recommended to Dr. Tress, which was the best thing that have happened to me lately.
Many people who are farsighted before the onset of presbyopia can see well at all distances. But when the natural lens loses its flexibility, it often becomes necessary for them to wear bifocals or even trifocals to see well at all distances. If you happen to be in this 40 and over age range and you're experiencing problems such as these, you may be eligible for a procedure that can restore your vision and eliminate your dependence on glasses for most activities. Cataract surgery is the procedure name we use if you have a visually significant cataract and you're experiencing blurry or cloudy vision. If you do not have a cataract, or if your cataracts are in the early stages of formation, the procedure is called refractive lens exchange.
Patients come in oftentimes for refractive surgery, LASIK surgery, and there's so many options available now. I mean, if all you think about is having a hammer in your tool belt, you're going to see nails in front of you all the time. Over here at Brevard Eye Center and Premier IMD, we provide not only LASIK surgery, but we also have refractive lens exchange as an option. And with refractive lens exchange, that's exactly what we do. We remove the crystalline lens before it becomes a cataract.
To restore vision after the natural lens is removed, your doctor will implant an intraocular lens, or IOL, into the place that held your natural lens. The procedure is performed as outpatient surgery, one eye at a time.
You arrive to our surgery center in Melbourne. You'll be prepped and draped in the surgery center. Surgery only takes a few moments to perform, about 5 to 7 minutes. After that, you go to the recovery area. You'll receive your postoperative instructions, and you go home. I mean, you'll want to take a nap, and you'll start seeing better that day, later in that evening.
I guess because I am a nurse, and I've been through many medical procedures, surgical procedures through my career and personally. I have never, ever encountered a smoother or a better surgical procedure than present-day cataract surgery that Dr. Trey has done. It was phenomenal to me that you could have this kind of impact, and your eyes are such a precious and valuable thing, and that you could go through this procedure and not suffer and come out on the other end and have such a wonderful experience from it. I think, money is an interesting thing. We are willing to finance great big cars and beautiful homes and all of great vacations and all that. It comes down to what value do you put on your eyesight? How important is it to you? And that's the bottom line. I'm not a wealthy person, so I made the decision because eyesight is important to me. It wasn't not having glasses on my face that mattered. My eyesight is what mattered. And that was why I made the decision to get the best I could. And Dr. Trace was able to give that for me.
Every part of my journey, before surgery, during surgery, and after surgery, was well taken care of, and it went so smooth. When I left, it was like leaving a family. So I really must say that Dr. Trace Palacio, he is so skilled, but also so are his staff.
Traditionally, patients receive a monofocal IOL that generally provides good distance vision without glasses or contacts. However, many patients that also have astigmatism will still experience blurry distance vision because standard IOLs do not correct astigmatism. Today, patients with astigmatism who want freedom from glasses for distance vision after cataract surgery can choose to have the Acrosoft Toric IQ IOL. The Acrosoft Toric IQ IOL not only clears vision when the cataract is removed, it can reduce or eliminate the blurring and distortion caused by astigmatism.
I just think he's great. I think he did a customized job for me. I didn't appreciate it before we went into it, but now that I realize it, I realize he put a toric lens in my right eye, and then he also put a high-definition lens in my left eye.
When I first meet a patient, review their chart, I always try to look at all of their activities, their hobbies, and I try to customize their outcome and their expectations to what we're able to achieve for them. And that includes a variety of intraocular lenses that not only can correct astigmatism, can also give you better near and distance vision and make you as glasses independent as possible.
Also, there are a number of advanced IOLs available today that can provide a full range of vision, meaning you can read, see clearly in the distance, and everything in between, with little or no dependence on bifocals, trifocals, or contact lenses for most of your activities. These include both accommodating IOLs and multifocal IOLs. The accommodating IOL, known as Crystal Lens HD, mimics the human eye in that it uses the eye muscles to flex the lens in order to focus on objects at all distances, thereby allowing you to do most activities without glasses.
Well, Dr. Trace Palacios, I went to him, and he mentioned what I needed, what were my requirements. And I told him, I said, here is what, eyesight is so important to me. I would like to be able to still do photo editing and photography. And he said, well, I think the crystal lens will be great for you. And it was a great choice for me. I want to see everything, and I want to see it well. And because everything to me is more vivid, clear, and why not have the best? Why not have the best lens to see those things that we love and cherish the most?
A multifocal lens does not depend on the muscles of the eye to provide clear vision. Instead, the optics of the lens distributes light to multiple focal points between near and distant vision to provide a full range of vision.
I've worn glasses full time since I was 16 years old. So there was never a day in my life that I didn't have to have a pair of glasses on my face. Now, when I thought about having cataract surgery and the thought of not having glasses had never ever entered my mind. And when Dr. Trace and I discussed it, we discussed several options. And one of the things would be you get a standard lens, and then you would need reading glasses. For me, that sounded horrible. I can't imagine anything worse than having to hunt up a pair of glasses every time I wanted to read a label in my kitchen or something that's on the television. So I opted to have something that he had talked about, which was the multifocal lens.
We tell our patients that it's a one-shot deal, and they really need to consider how they want to see for the rest of their lives. 5 years from now, if they change their mind, it's not that easy just to go in and change it, and it's usually not performed on an elective basis. So they're really making a decision that they're going to have to live with for the rest of their lives.
I had been paying anywhere from $700 to $900 a clip every time I got new glasses because I had bifocals and I was sensitive to light, and so I had to have transitions. So all of these things, I mean, that over you talk about from the age 16 to my gentle age at this point, and that's a considerable expense. So when I talked about the option of having the multifocal, and I would go without glasses. And so that's what I opted for. I don't have any glasses. I can read a novel, I can read the phone book, I can watch television, I drive my car and can read road signs. And the fun thing is, I get to buy sunglasses over the counter. I've already gotten 4 pair.
It's worth the money to know that this is probably the best eyesight I've had in at least 30 or 40 years. It's like you're young again. You remember your eyesight being focused and clear, and I haven't felt that way in maybe 30 years.
Which advanced IOL is best for you depends on the unique characteristics of your eye, as well as your lifestyle needs.
My sister is jealous of me because she's 3 years younger than me, and she tells her friends that she can't believe that she's looking at me and I'm looking at the TV and I'm reading mail and I'm doing everything and I don't have glasses. And before, I mean, I literally was feeling around for my glasses and panicking if I couldn't find them. So it's very significant, the difference, very significant, not only to myself, but to people who know me.
It's a very rewarding experience being an ophthalmic surgeon. I love what I do. You come in, you see very happy patients that are actually excited to see you because of what you can do for them. So I love what I do, and I love seeing happy patients every day.
Just set your priorities of what is important to you, and I think your sight is one of the most important things that you can have. To clear sight, that you're unlimited, that you can do anything that you want to, that you haven't done in years. It's well worth it. And I certainly will recommend Dr. Tress to anybody that I happen to meet up with.
I think every doctor, every good doctor that's out there, wants to perform a valuable service for the people that they take care of. And I can honestly say, Dr. Trace, you have opened up a world for me that I never imagined I would ever have available. And I thank you. More than just my thank you, I thank you from my heart.
Dr. Rafael Tres Palacios was born in New Jersey and raised in Inverness, Florida. He completed his undergraduate studies and obtained a degree at the University of Central Florida. Immediately following UCF, he attended the University of South Florida in Tampa, where he obtained his medical degree. He then completed a 1-year internship at the University of South Carolina and a 3-year residency at the same institution to obtain training in his medical specialty, ophthalmology. He was recognized and honored by his medical colleagues and students in training as Resident of the Year. He was also the recipient of the tremendous honor of being acknowledged by the medical faculty in selecting him to serve as Chief Resident, as well as being selected for the Bylaws Committee by the hospital administration. It was at this point that his training became differentiated from the majority of ophthalmologists, since he chose to spend over 1 extra year of study dedicated to the subspecialty of the cornea and refractive procedures. During this time, he was the private student of one of the leading corneal specialists in the world at the Cornea Research Foundation of America. Here, he participated and garnered first-hand expertise, pioneering complex corneal procedures, including advanced corneal transplants, artificial corneas, artificial irises, implantable contact lenses, and intacts for keratoconus. This experience allowed Dr. Tres Palacios to further perfect and enhance his skills as the premier refractive surgeon. It is this extra level of expertise and knowledge that allows Dr. Tres Palacios' surgical palette to include the full complement of beyond LASIK and cataract procedures. Life has come full circle for Dr. Tres Palacios. He brought these skills back to East Central Florida, where he has served for years as the Director of Refractive Services at Brevard Eye Center, performing thousands of sight-saving procedures every year. During this time, he has developed a reputation for excellence and is one of only a handful of surgeons in the nation and the only ophthalmologist in East Central Florida with surgical results so outstanding they are independently insurable. He is also presently a professor of ophthalmology at the University of Central Florida College of Medicine, his alma mater's newest addition to the medical community right here in Central Florida. Dr. Tres Palacios has authored and co-authored multiple publications in the ophthalmology literature, as well as being board certified by the National Board of Medical Examiners, board certified in ophthalmology by the American Board of Ophthalmology, and a fellow of the American Academy of Ophthalmology and the American Society of Cataract and Refractive Surgery.